Good evening. Tonight's rounds with Dr. Soloway are quite interesting. We're going to take our most interesting case of the day, which was a middle-aged female who presented to the office 3 years or more after her last visit. When the patient was here at the office several years ago, she had been diagnosed with a seronegative arthritis, had been treated with low-dose corticosteroids, had never gotten a chance to get on DMARDs as the patient became lost to follow-up. The patient came back today with complaints of polyarticular pain, inflammatory in nature. The pain was predominantly in the MCPs and wrist, as well as the elbows and shoulders, the ankles, the metatarsals, occasionally the hips. In addition, the patient had low back pain that was completely independent of the peripheral joint pain. Independent in the sense that that pain was predominantly worse with use, with standing, going upstairs. The peripheral joint pain I mentioned was inflammatory, meaning there was almost an hour of morning stiffness in those joints, there was swelling, tenderness, and there was warmth. The patient did complain of buttock pain as well. X-rays were done today, and X-rays did reveal sacroiliac changes. I did send the patient for a CT of the sacroiliac joints today because I can get it done quicker than an MRI. The CT also confirmed that there were abnormal sacroiliac joints bilaterally. The patient added to the history by indicating that about a month ago she had seen her family doctor who gave her a Medrol dose pack, and the Medrol dose pack took away all her pain except her back and her buttocks. So in summary, we're dealing with somebody who has an inflammatory polyarthritis, perhaps involving the spine, but clearly involving the peripheral joints. And we're dealing with somebody who may have a non-inflammatory process in their spine, or both inflammatory and non-inflammatory process in the spine. So, since this patient has a seronegative arthritis with sacroiliac involvement bilateral, the differential diagnosis becomes somewhat narrowed pretty quickly. The differential diagnosis would be ankylosing spondylitis, reactive arthritis, Crohn's disease, ulcerative colitis, sarcoidosis. I always like to include HLA-B27 related uveitis. Crohn's, ulcerative colitis, psoriasis, psoriatic arthritis, reactive arthritis, ankylosing spondylitis, maybe Whipple's disease, and Behçet's. They can involve these sacroiliac joints. So the differential diagnosis becomes quite narrowed, as I've just alluded. Now, the patient's peripheral joint pain went away with steroids, and the blood work that is pertinent, the HLA-B27 is negative, the platelet count is elevated, and this blood work was done within the past month. The patient happened to have a PR3 antibody of 5.0. The normal in the lab was less than 3.5. I take this as an acute phase reactant, and I don't take this in any way that this patient has a vasculitic disease. There were no upper respiratory symptoms. There were no specific chest symptoms, upper or lower respiratory tract, and there were no urinary findings, not in the urine and not by patient complaint. So I want to show you how I discuss this with patients, but before I do that, I just want to touch on her low back pain. The low back pain was worse with use and better with rest. So with tenderness directly over the facet joints at the lower lumbar spine, L4, 5, and 5-1, worse on extension, this would tell me the patient likely has OA of the lumbar facets, and the treatment for that would be injection of the lumbar facet joints. Adding to that, maybe a lumbar support and physical therapy. Failure of NSAIDs, failure of acetaminophen. Occasionally use gabapentin or pre-GABA. Okay, so let me show you how I discuss this with the patient when I would try to explain this. I'm going to turn the camera around, I think. Well, if I can't, I don't know. All right. Let's see. Sorry about this. All right, well, it doesn't look like I'm going to be able to do that. So I've made a graph here, and it's inverted, of course. I don't know how. I'm going to turn off the video, take off the selfie mode, and I'm going to turn it around and then just talk the rest. Thank you, and be patient.